in terms of infectious diseases in China, this is just data from the Chinese Ministry of Health in 2011. AIDS still has the greatest mortality in 2011, over 9,000 deaths attributable to HIV infection, followed by tuberculosis, rabies, surprisingly, viral hepatitis, and I think in recent years, hepatitis B and C in particular have particular importance, especially as we have new therapies for hepatitis C infection, hemorrhagic fevers, syphilis. We'll get to that in just a moment. H1N1 influenza, Japanese encephalitis, and tetanus. And so there's some non-notifiable infectious diseases that are associated with substantial burden of disease, like HPV, influenza that we also discussed. We divided it sort of based on transmission routes. And to go back to and sort of expand on Kathy Zimmerman's theoretical framework, I think it's worth thinking about the different phases of migration. This is getting away from the idea of migrant as just sort of a dichotomous outcome. Is this person a migrant or not? And thinking about the richness and the sort of diversity of the phases of migration. So before someone goes, the pre-departure phase, they haven't set off yet, but they're going to leave, the place of origin. The travel phase, so once they get on the bus, the train, the whatever form of transportation, they're moving to the destination. And in China, this is sort of the urban coastal region of China. And then the interception phase, which is also really interesting and important and shouldn't be forgotten. So when there is a hiccup in this migration process, when someone's intercepted or they in transit return home, and then the return phase, so coming back to the place of origin. And this framework is really important to consider, and I think a useful one both in practice and in policy. So in terms of infectious diseases, I'm going to go through these by transmission routes and talk just very briefly about some different infectious diseases that are related to the migration process. So airborne diseases, tuberculosis is a classic example where you have travelers with a higher incidence of tuberculosis, and it's spread through droplets. And if you, similarly with SARS, if you look at the train routes that SARS patients took, it's very literally spread was related to migration of infected individuals. And I think we'll get into sort of the policy component of this, but these TB, SARS, very important diseases. The other important disease in the Chinese context that's been forgotten and recently has made a resurgence is measles. So vaccine-preventable diseases. Why is this more common among migrants? In the pre-departure phase, vaccine coverage is often quite low. And then once migrants get to their urban destinations, there are sort of supplemental vaccine programs in effect in a lot of cities, but they're not complete. And so incomplete vaccination at the destination among migrant children can also contribute to the spread of measles. Bloodborne infections, HBV and HCV, as I said before, this is another issue. The safety of the blood supply in China is not as good as it is in other countries, but I think as testing becomes improved, bloodborne infections will be less and less important. Sexually transmitted diseases, and this is a field where Professor Lee's made a great contribution, thinking about how migration and STDs are related. So in the context of China, if a businessman or a MMM, mobile man with money, goes away from his wife or girlfriend on a business junket, then they go to the business banquet, they eat, drink, purchase sex, and then bring home their syphilis to their girlfriend or wife. And so the intersection between STDs and migration in China is a very important one. And thinking about, so this is kind of what we've gone through. Each of these different phases, there are specific infectious disease issues that come up. In the pre-departure phase, low coverage of vaccination in rural areas, a high burden of diseases. In the travel phase, cramped living conditions, and obviously it's inhalation of the respiratory pathogen. At the destination phase, barriers to accessing healthcare among migrants. This is another sort of theme that emerges. In the interception phase here, cramped living conditions, risky behaviors, and then in the return phase, bringing back new diseases to the place of origin. And so thinking about policy interventions, taking these same phases and then thinking about how could they be used to improve infectious disease control measures. So in the pre-departure phase, school-based vaccination programs are certainly being expanded for hepatitis B, for measles. Rural hospital infection control programs are expanding. Within the travel phase, there's more surveillance and monitoring system improvements that are being made. At the destination phase, there are more vaccine programs, disease-specific programs related to HIV, STDs. The interception phase, right now in China, there's a large detention system. So re-education through labor and related extrajudicial measures. This detention system enforces a sort of huge number of regulations, and many migrants are tested for STDs, but a kind of more responsive system within detention that's more responsive to migrant health is slowly evolving. And the return phase, so obviously the availability of health system records and providers. This innovation there that's interesting in China has been the TB system, where you can have your TB records, the clinical records, are not tied to a specific clinic. So you can follow up and be treated at a number of different clinics as a migrant. And I think that's, in that health systems perspective, it's one sort of strong point that merits further consideration. The other kind of innovation here that's important is point-of-care diagnostics. Point-of-care tests like these are really pushing our traditional clinic-based testing out into the community. So it used to be that you'd have to get into a clinic, and now these point-of-care tests really, these are simple, inexpensive, a drop of blood, and within 15 minutes you have an HIV test result. And so oral testing is also becoming more accurate. And so this kind of point-of-care diagnostics opens up opportunities for phase-independent studies and comparability. There's still a lot of knowledge gaps in terms of migration and infectious diseases in China. A lot of population-based representative studies fail to incorporate migrants, and the interception phase really requires more careful research. So what happens along the route? Migration is often treated as this dichotomous outcome, as I mentioned before, rather than a dynamic process. The other sort of interesting trend that our group has noted in Guangzhou is a large group of African migrants. So there are over 200,000 Africans in Guangzhou, and there aren't, in a policy perspective, this is a white space. There isn't a lot of focused policy looking at the African diaspora in China. And so thinking about the well-being of African migrants in China and Chinese migrants in Africa is another sort of important area. And the other thing about sort of infectious diseases and health that's another opportunity is that health reform in China. Right now, China's going through a massive health reform process, and this gives a platform to think about more migrant-responsive systems that promote more universal healthcare access. And I think if you look at infectious diseases, even though many infectious diseases are decreasing over time, this is still a key area to consider when we think about migrant health. So thanks for organizing this, and thanks to our team at the Sun Yat-sen Center for Migrant Health Policy, Professor Ling Lee's group, and happy to answer any questions afterward.